East Texas Live on KETK. Well, joining us now in the living room is Dr. Andrea Ellis.
And today she's going to talk to us about the importance of colon cancer screenings. Good morning.
Good morning. Great to be here.
Yeah.
Thank you for coming on. You know, I've spoken to some people out there are like, you know what? My family doesn't have a history of colon cancer. Why should I get a screening? What would you tell those folks?
Yes, that's such a good question. You know, colon cancer is very common. It's actually the third most common cancer, and it's the second leading cause of cancer death. And what I say to those people who don't have a family history is, you know, if we wait to screen people who are symptomatic, we've often waited too long, and the cancer may be very advanced. So certain symptoms of colon cancer are microscopic blood in the stool that is not visible to the naked eye often. Sometimes a change in bowel habits. But again, if we wait till those symptoms appear, it's often very late. So we want to catch people who just have little polyps, which are precancerous or can be precancerous growths.
Yeah. Well, and sometimes people are a little freaked out by the whole colonoscopy procedure.
Yes.
So you guys do offer kind of a less intense version, an in-office screening.
Yes.
Tell us about that.
So for those who aren't candidates for colonoscopy or who cannot tolerate the prep, there is an option to do a yearly stool blood test. And that's something that can be done really actually in your own home. You get a little packet that you bring home and that you mail back in. And it's very simple, non-invasive, it's not costly. So it's a good alternative for those who can't do a colonoscopy.
Yeah.
So who should get that in-office colonoscopy screening?
Yeah, well, I would say really the first priority should be doing colonoscopies in anyone that can, because it's a far superior method of detecting cancer, for one, and two, it's not just for screening, but actually you could look at it as a preventive tool, because during a colonoscopy you can actually remove a polyp, and so that could actually prevent that polyp from then turning into cancer. If you have a positive stool blood test or any other method of screening that yields a positive result will mean that you will need to get a colonoscopy. So really everyone should consider having a colonoscopy if they can, and if they can't afford it or they can't tolerate it, then a stool blood test would be a great alternative.
So if you find something abnormal, something's wrong, what's the next step for people then?
Right. So it depends. Often during a colonoscopy, they'll remove several polyps, and then they will look at those polyps under the microscope and determine if they're cancerous or precancerous or benign. And that will determine then the kind of interval for the next screening. If it's a totally normal colonoscopy, it would be 10 years. And if it's abnormal, if there are some polyps, it may be 3 years or 5 years or even 1 year, depending on the number of polyps and what kind of polyps they are.
So at what age, I don't know if age is a factor in this, but at what age should one start considering, you know, going to their doctor and asking, hey, you know, is it time to get a colonoscopy?
Great question, yes. Generally at age 50 is when we start screening most adults. Now there are some exceptions. There's a recommendation to start at 45 in African Americans. And there's also, if you have a family history, then we recommend starting at 40 or at 10 years before your relative was diagnosed. And it's what we consider a strong family history is a first degree relative with colon cancer. So that would be like parent, sibling, or child.
Yeah.
So
well, and with colon cancer, I mean, do people usually catch this beforehand? Are there symptoms? Are there signs? Or how does that work?
Right. Well, and kind of like we talked about before, you might have blood in the stool.
Okay.
You might have a change in bowel habits, and that could mean actually, you know, suddenly having constipation or suddenly having diarrhea. I've seen both. So some change in bowel habits, or you know, that is always something to bring to the attention of your doctor. And in those cases, we may do a diagnostic colonoscopy earlier than the planned screening age at 50. So we do those in people much younger.
Yeah.
And there's also some familial syndromes where people have colon cancer from a very young age, even in their 20s and 30s, called Lynch syndrome. So if you have a very strong family history of colon cancer, it might be worthwhile even to consider genetic testing.
Earlier, yeah. Okay.
All right. Well, thank you so much, Dr. Ellis. A lot of useful information.
Yeah, thank you.
Thank you so much.
Thank you.